Sotiri, how do you go about assuring quality for each patient case?
In the US, we follow the AAPM recommendations, and we're actually waiting for the new recommendations that should come out in the next few months. For IMRT and VMAT patients planning, we do a QA prior to every treatment. We use usually detector arrays, 2D or 3D, and before every treatment we will verify that the planning process from the planning all the way to the delivery is accurate and is correct.
So what are the specific challenges with regard to that, or what are the current trends?
We have to take into account the whole process. The process starts when the treatment plan has been approved and the data has to be transferred to our record and verify, and then we deliver the plan on a known geometry. That's our IMRT QA device, and we compare our measurements with a calculation. We have to use some recommendations per TG119, the AAPM TG119 recommendations, and we have to make sure that our plans are within those tolerances as described in that report.
So is the challenge mostly in the technology?
Challenge is mostly in not in the technology so much, but basically in the implementation of the plan. Sometimes there is not very good agreement between what we have planned and what we are delivering. In these cases, we have to go back into the drawing board. We have to start in the beginning and make a new plan that will satisfy our criteria.
So with regard to QA, there are two different approaches, right? One is hardware-oriented and the other one is software-oriented. Which one do you go for and what's the benefit?
The QA software part is usually streamlined right now. All of the major vendors have a very nice, intuitive, user-friendly software. The algorithms used for the analysis are more or less similar from one to another, so there is not a big challenge there. The hardware is different depending on which vendor you are using for your QA. You can go with vendors that provide 2D solutions, 2D arrays, all the way to vendors that provide 3D detector arrays. Others provide diode-based or ionization chamber-based arrays. So you have to know the limitations and the advantages of which array you're using, and then you have to adapt to it.
Systems do you use at the University of Texas Health Science Center in San Antonio?
For patient-specific QA at the University of Texas Health Science Center in San Antonio, we are using several products because we want to be more efficient and manage our time. So our major QA devices is the PDW Octavius system, the Scandidos Delta 4, and we also have the IBAI Matrix 2D array.
What all is involved with regard to linear accelerator QA?
Right. For linear accelerator QA, you have to do a daily, a monthly, and an annual QA test. Apart from safety, we have to check mechanical and dosimetric parameters of the linear accelerator on a daily, monthly, and annual basis. This involves a lot of hardware that at this point we have at the University of Texas Health Science Center that helps us with our tests. And then a lot of software solutions that use the measurements made with all these devices in order to perform our analysis and finish our QAs. Starting with an annual QA with a water tank system, the one that we have is the PDW MP3 tank with a Mavisto software, which is used basically on an annual basis to each of our 5 linear accelerators for dosimetric QA, and then monthly based the devices that we have that really simplifies our job and reduces the time required. We are using 2 detector again arrays, which are more specifically designed for monthly or for this kind of tests. The PDW star check and an array and a number of different ionization chambers that will tell us how good or how accurate our dose calculations and our dose is, our radiation dose is, if it's within the specified limits or the tolerances that again AAPM TG 142 report recommends.
How would you rank your organization in comparison with other care providers in the US?
I think we are, well, I don't know if it's ranked. What I can say is our institution has a lot invested in education. We have several education programs from dosimetry schools, medical physics residency training. We have doctors of medical physics that we train. We have a number, about 10 to 15 graduate students at the Ph.D. level. We also have a medical residents that we train to become the next radiation oncologists. So we have invested a lot in education. On top of that, we have a large research component. We have several PhDs working on several projects that are related to IMRT, VMAT planning, to quality assurance, to LINAC QA, and this is also reflected in our presentations here at the AAPM. We have about 30 or more presentations that the University of Texas Health Science Center alone is, has posters and oral presentations. And then we have clinic. The clinic is covered by our 5 physicists and 4 now residents, and our residency program, medical physics residents, and our medical physics residents program is growing with the addition of the doctors of medical physics. So I don't know how to rank our institution, but we do a lot. So we're keeping busy.